What I'd like to go over this morning is how Best Doctors does what we do. We are a global company serving approximately 34 million individuals around the world. We have offices both in the U.S. as well as in Canada and in Europe, Australia. And we have a very comprehensive way of getting at clinical information when folks reach out to Best Doctors. So how do we do what we do? Best Doctors in the U.S. is typically offered as an employee benefit. So large companies such as Boeing, Northrop Grumman, Home Depot, Procter & Gamble, Merck, all have Best Doctors as an employee benefit. And what that enables all of the employees at these companies and their family members is the ability to call Best Doctors should they be faced with a serious medical situation. Very recently, we had a woman who reached out to Best Doctors. She was recently diagnosed with cervical cancer. She had a very large mass that was in the pelvis, had invaded the local bowel. She wasn't getting better on chemotherapy. It was through the Best Doctors process that we learned that indeed it wasn't cervical cancer. This was actually a case of colon cancer. The basic pathology had never included immunohistochemical staining, and that staining, which was done at the MGH, revealed that this poorly differentiated adenocarcinoma was colon in origin, not cervical, and obviously she had been receiving incorrect chemotherapy. She got on the right therapy, and she's actually responded very, very well. So in a case such as that, the first step would really be that the patient or member, as we call them, would reach out to us. They will have a very comprehensive clinical intake done. Following that very comprehensive clinical intake in which there's a thorough review of the patient's current history as well as relevant past medical history, we really go to work in terms of a very comprehensive medical records collection. This can take sometimes 2 to 4 weeks. We don't just assist the members in the collection of their medical records. We actually collect all the medical records on their behalf. They sign out various release forms, and then we have a large department of over 50 individuals who basically that is their full-time job, going across the globe, collecting medical records, collecting radiology, collecting pathology. We have a team of physicians who goes through these records and really creates very concise clinical summaries. These are very academic and really detail for the expert the key features of the case. Importantly, they also include about 10 to 15 questions to the expert. We feel as though we get the best out of our experts by really being very specific in terms of the type of information that we want to glean from the case rather than saying, what's your overall impression and plan in terms of what should we do here. We retest pathology, so that was very important in this most recent case. The pathology really revealed that this was colon cancer, not cervical cancer. We also have a cloud-based imaging platform where we directly share the CTs, MRIs, and other radiologic information directly with the experts. So when they're opining on a case, they're not just relying upon a radiologist's report. They're actually seeing the films through a dedicated viewer. We have an algorithm by which we select the experts. In this case, it was a top expert in terms of colon cancer. The expert will go over all of the clinical summary and the questions and provide their comments. They'll develop their expert report that would be appearing on their actual institutional letterhead. We have a quality team where once that expert report comes back, make sure it's evidence-based, make sure that all the questions were thoroughly answered, and make sure that there were references to the recent medical literature provided. We then deliver that expert report both to the member as well as to their treating physician. We review the report with the treating physician. This is a collaborative process. It's not medical legal. It's not utilization review. It's really a way of, through this platform, delivering what we see as the very best in terms of medical expertise and also case preparation right at the point of care. We then follow up with the member. We want to know, were those suggestions actually integrated into the patient's plan? Because we don't want to be in the book report business. We really want to be helping in a collaborative way the ongoing care of the member. We have found through our book of business, over 95% of the time, our recommendations are put into practice. The result, about 39% of the time there is a change in diagnosis, and 60% of the time there's a change in treatment.